Hi, this is Dr. Brian Fallon from the Columbia University Medical Center, and I'm here today with Jessica, who's going to talk to us about her worries about illness. She has suffered with hypochondriasis for quite a while, and she's been generous enough to share her story with us. Um, this segment on hypochondriasis is part of a series of segments in which Dr. Arthur Barsky of the Harvard Medical School and I, with Dr. Kelli Harding, are talking about different aspects of hypochondriasis. If you'd like to learn more about hypochondriasis, you can check the Boston site, which is www.thehealthstudy.com, or our Columbia website, which is www.illnessworry.cumc.columbia.edu. And we also have a research study, a treatment study that you could participate in if you wish, and you can learn about it on that website, either website. So Jessica, thank you for coming in today. Can you tell us a little bit about your illness worries? When did they start? What are they like?
Well, I think I started worrying when my father died of heart disease. It was a very unexpected heart attack when I was 10. And, I wasn't worrying excessively, I would say, at that point. But that's when I really started to think, I was still a kid, but I really just realized I'm not invincible anymore. And it really just was a blow to my world. And recently, I'm a teacher. I teach 8th grade up in the Bronx. But maybe a year or two ago, I moved up from teaching 3rd graders. And I think something about that job switch really triggered some worries in me that have really started to increase in the past 2 years since I've changed the positions. I've been worrying mostly about heart disease and also breast cancer. Now, I've been checked maybe once in the past year. I generally don't like to go to doctors.
Sorry, you got checked for what?
Well, I had like an EKG, I had my blood pressure checked, my cholesterol, that sort of stuff for heart disease. And
Was
the doctor
was
said,
that part of a routine check, or you actually
no, I went in. Yeah, I usually don't try not to go to doctors. Okay. But I did go in and check it because I've been having a lot of trouble sleeping because I go to sleep at night and I would feel my heart just start to beat very fast. And I know that you're supposed to be able to like take deep breaths and slow down your breathing, but for me, I just couldn't do it. Whatever it was, my heart would just go faster and faster. And that's when I started to think there must be something wrong with me. There must be some reason why my heart won't slow down. And then very recently, even it's been posing some problems at work because I'll be in the middle of a class and we'll start to think, I'll start to feel very flushed or like feel my heart start to race, what almost feels like palpitations. And I actually stopped class early and sent my kids home because I was so afraid I was going to have a heart attack in front of them.
Well, now let me ask you a question because this is an important distinction. When you have those feelings of your heart racing or feeling flush, does it occur out of the blue, or are you actually worrying about an illness beforehand?
Well, I don't know. I mean, they seem almost to come out of the blue, but oftentimes it's in like quiet moments. Like for instance, I also, as I mentioned, have been worrying a lot about breast cancer recently. So I would say maybe 4 times a day I go to the restroom and check because I think I have a lump by my armpit and one of the nodes.
What makes you think you have a lump there?
Because I have one.
So you've checked it and you have a
lump.
lump.
And the doctor says it's nothing, but I mean, every day it seems to get bigger. It's very tender. It's even like bruised. I mean, I check it very often.
Why do you think it's bruised? Because you're checking so much?
I'm not sure. I mean, I think it's breast cancer.
You think it's breast cancer?
Yeah.
And how strongly do you believe that? Do you believe it like 100% or 80%, or does it waver?
I mean, I would say 100%, but the test shows that it's not.
Okay, so that's pretty worrisome.
Yeah.
And you've been to the doctor says it's not, but you worry anyway.
Yeah, well, I don't want to go back to the doctor and check it again, but it's definitely gotten bigger since I last saw the doctor. And it's like more tender. And so when I go in to check it, it's very difficult for me to stop. I mean, I have a class to teach, obviously, shortly afterwards. But often after that period, I'll go back in to teach, and then we'll start to think, well, all of these things are wrong with me. And then I start to think also about, worrying about getting a heart attack, like in the middle of my class, which I don't know what I don't know what I would do.
Okay, so you worry about not just heart disease, but you also worry about breast cancer.
Yeah.
What's the likelihood, do you think, that someone would get both heart disease and breast cancer at the same time?
I don't know.
It's probably not that likely, right? I mean, you're a teacher, you're a smart person, but even though you know it's not that likely, you still worry.
Still, yeah.
So you can't
of course. I mean, you have the symptoms and they're real.
And now let me ask you, in your childhood, you said when you were 10, you had the very sad experience that your father died. Was that traumatic at the time that you actually saw your father die? Was he ill for getting ill?
No, it was very shocking.
So it was quite sudden.
Yeah.
And did you have illness worries at all, like in your teenage years, or did you have any other kinds of intrusive thoughts or worries that came into your head?
I mean, I had a brief bout with anorexia when I was about 14, but that was the only time that I was ever treated for anything else.
So you were worried about your body image, or you were losing weight, or what happened?
Well, I was definitely losing weight. They hospitalized me for a while.
Oh, really? So you were quite distressed at that time.
Yeah.
Okay. Has anybody ever told you that sometimes people who have like anorexia, eating disorder, that's a type of worrying, because there you're obsessing about food and you feel compelled to check everything, and it sounds like now you're sort of obsessed about your lump and you're checking it, and you're actually making it worse.
Maybe.
Have you ever sought treatment for this?
No, I mean, you read so much about how doctors really just aren't paying attention anymore. No offense, I know you're a doctor, but they're not doing house calls anymore. You go in, 5 minutes later they kick you out, and who knows? I mean, even if they were able to find out what I have, I would rather not know in a way, and that's why I often just avoid it entirely.
Now, let me ask you. You're here talking to a psychiatrist. I mean, why did you actually come in to see a psychiatrist?
My sister told me to.
Your family member told you to.
Yeah.
Do you have any times where you actually believe that you might not have breast cancer? Like sometimes you have some insight that maybe you...
I mean, I did feel somewhat reassured after having the test done for maybe a day, maybe a couple days, but then just the worries came back, and then and you still have I still had the lump there, and so when you look at it and it's still there and every day it seems to get worse, how can you not worry? And when you go to sleep at night, like usually the heart worries come to me when I'm trying to unwind the day. I've made my lesson plan, I've been able to put it out of my mind, and then when I take the moment to be quiet,
that's when it's the worst.
That's when I can start to feel it, and instead of calming down, it will start to race. And with those things in your face, how can you deny?
Yeah. Okay. So Jessica gives us a classical story of hypochondriasis. She actually had a traumatic experience at the age of 10, a sudden loss of her father. At the age of 22, she starts to find herself preoccupied with her own possibility of having heart disease. So not only does she worry excessively about illness, but she's checking with physicians. She's doing the bodily checking of checking her lymph nodes and actually causing a problem. She actually does have inflammation and redness and soreness. So she really does have hypochondriasis. She may also have panic disorder, which is one of the anxiety disorders in which people spontaneously, out of the blue, experience sudden palpitations and shortness of breath. That's actually not hypochondriasis, that's panic disorder. But certainly the thought of illness, cancer in particular, causes her to feel flush and have a lot of nervous symptoms as well. Jessica's actually not a patient. She's an actress, but she is very well informed about the problem of hypochondriasis and has done a great job depicting someone with hypochondriasis. If you want to learn more about hypochondriasis or maybe participate in a research study, please check the website that we listed earlier. call the Boston site, which is Harvard Medical School, Dr. Arthur Barsky, because they're conducting this study, and so too are we at the New York State Psychiatric Institute, which is part of the Columbia Medical Center. Thank you very much. And we have other segments. Please take a look out for those on YouTube.